Morning, everyone. How many here believe to achieve what we want in our lives, personal and professional, that we have to set actionable and specific goals? Good. Well, what we know is that both successful and unsuccessful organizations have goals. And in most cases, those goals are the same. So if it's not the goal that differentiates the winners from the losers, then what is it? I believe it's the environment of small, continuous changes daily. Those changes that we create when we change our behavior, creating routines that become habits, that become the processes and the systems that sustain our organization. So let me add a little color to that, okay? When I was the executive director at Mountain Valley in Kellogg, a 68-bed skilled nursing facility, we had a lot of really amazing goals. And in some areas, we struggled achieving our goals, despite all of our efforts. In 2005, we began working with the Baldrige Excellence Framework. We began using that framework when we applied in 2005 for American Health Care Association's Bronze Award. Now, when I say working with the framework, I say that very loosely, because we truly didn't understand anything the framework was saying. So we were successful in achieving the Bronze Award and moved into the Silver criteria. So in 2008, we applied for Silver. At this level, it began asking us about our approaches, our processes, and our systems. Now, we may have had all those, but since we didn't understand what they were, we didn't know if we had them or not, right? So we responded to the criteria, and again, we were successful. But in our success, we received a great big feedback report with lots of OFIs that says, you need more learning about approaches, processes, and systems in your organization. So our team began daily taking our feedback report, the gold criteria, and an exercise every day. We began responding and writing a gold application. And honestly, we did this to become a gold recipient. We worked on our processes, all the things that we wanted to do, and what we found was we went from goal thinking, like we had been in the beginning, to long-term thinking as we started to mature in our processes. So through all of that, we were successful, but in 2010, we looked at our results and we thought, wow, these are really great. We can quit all this award process stuff, right? That's a lot of work and a lot of time. So as a senior leadership team, we decided we were finished writing quality award applications. Our results were already really good. When we sat back as a team and said, how did we get here? And overwhelmingly, what we identified was the exercise of responding to the criteria that process had changed our progress to our goal. And not only had it changed our progress to our goal, we had really good results. And we were able to sustain them over time because of those repeatable systematic processes and systems that we had learned going through that whole process. So we sustained them during leadership changes and during very turbulent times over the last 2 years. So this all sounds really easy, right? We should be able to add a little hot water, rinse and repeat, and I should be able to take all of this and go to another building and do the same thing. Again, I'll add more color. In 2019, I was asked to help another building that was one phone call away from being decertified based on poor survey outcomes. And they had a new leader, Eric. Now, Eric wasn't new to long-term care. He had partnered with another organization with our long-term care buildings and was very familiar and had been very successful. However, this was his first time of being a skilled nursing home administrator. So I walked in with all these great, mature processes and introduced him to his team, and I got nothing. I got no engagement from the team. We certainly didn't make any progress towards any type of goal. And I wondered if maybe I had let Eric's team down, or potentially maybe Mountain Valley was one and done, right? So I had a resource, Ira, And Ira had been a senior leader in Mountain Valley throughout our whole quality journey and now had moved into a resource role with me. I said, Ira, what am I doing wrong? Why can't I get anything to stick in Coeur d'Alene? And he says, oh, Maryruth, you need to realize that at Mountain Valley, we're all Baldrige children. We don't know any different. He said, you have got to quit talking that Baldrige bibble babble and start talking their language. And he went out and had a t-shirt made to remind me when I began doing that. So Ira was right. We began our quality journey in 2005 with the Bronze Award, and this was 2019. That was 14 years. All the senior leaders at Mountain Valley, that's the only environment that they ever knew. I had to go back to what that team did to help Eric and his team be successful in terms of starting at the beginning with changing our behaviors, implementing routines, creating habits that we wanted to become our processes that would sustain us time over time. So I went back to Eric's team and we started working on how we were going to create an environment. How would we create an environment for success? And we liked it to like a diet. If you're going on a diet, you wouldn't have a bowl of candy on your counter, you'd have a bowl of fruit, right? So we had to make it easy. We're changing behavior. We want to develop routines that we hope will become habits, so we're going to make it easy for them. So we went through and we set up very, very specific resident interventions because we were going to work on falls with major injuries. But we didn't want to really be resident specific because we're working on approaches and processes and systems that are not dependent upon one person, because if that person leaves, all these things stay in place and they can sustain what we worked so hard to implement. So we started setting up this environment for success. We trained everyone, we made some mock incident reports so the nurses that were working knew exactly what we needed. We did some screenshots of EMRs of our fall assessments so they could just follow right down, again, making it easy for them. We created checklists. We all know that checklists reduce error, reduce stress, free up our mind for greater things, setting them up for success, making it easy for them. We did visual mapping for the staff with our fall graphs. We posted them. We let all of our staff know what we were working on, let them see our progress, communicate it to them so they would engage in the whole process. So in the first quarter of 2019, when I began working with Eric's building, his falls with major injuries were 6%, which is much higher than the state and national averages. In the first quarter of 2021, 2 years later, they were 0%. Now, did our goal change? No, our goal was always 0%. What changed was our behavior on how we set up our environment for success, how we created routines with hopes that they would become habits that became the processes and the systems that that team implemented and became successful with it. So I'm happy to say that Eric and his team have gotten some momentum. They have went from a 1-star in their overall survey rating to a 3-star, and from a 1-star in quality measures and quality indicators to a 5-star. And they did this by using small changes. One of the themes that I've heard throughout the last 3 days that we've been here is small bites, getting back to the basics of our processes. And that's what I had to learn when I went from 2005 to 2019 and began working with a new leadership team. So 3 things that I'll leave you with. One is, when you start changing your behavior, it's uncomfortable. So expect some discomfort and just know you're going to have to push through it, right? 2, in the case of Eric's building, we created new routines that we wanted to be habits. In order to have a habit, you have to first have a routine. Hopefully it will become a habit. But if it never becomes a habit and it's just a really great, repeatable, systematic routine that's effective, that's good too. That's a win. And lastly, compound growth takes time. Don't get discouraged. Like in the case of Eric, it took 2 years for his building to cross that critical threshold, where suddenly things, through changing his behavior, his team's behavior, became unconscious competence in his staff. They became automatic. And in that case, if a staff member left, all those processes stayed in place. The processes support the building, the people support the processes. So remember, routine can become great daily habits that become the processes and the systems that we want to support our organization and to get back to that quality that we had in 2019 before we were just doing all of the COVID stuff. Small daily changes will equal progress and equal success. Thank you.